Hello friends, as I have told you in my previous videos that diabetes is increasing day by day. In India, the incidence of diabetes is almost 1 out of every 5 people after middle age. So, after about 45 years of age, we are seeing that the risk of diabetes is going on increasing day by day. And one of the major risks for diabetics is diabetic retinopathy. That means that there occur changes or damage to the back portion of your eyes, that is the retina, which is responsible for vision. What happens there is there occurs sudden damage, like the blood vessels become very delicate, friable, and they start oozing blood. And as time increases, there may be certain bleeders within the retina here and there, and there may be new vessel formation, which adds more to the problem. This diabetic retinopathy occurs more in those people who have uncontrolled diabetics for at least more than 5 years. Now, it may be possible, apart from diabetes, if one is having some other problems, systemic problems, or other major disturbances like increased cholesterol levels, high blood pressure, or if the kidney dysfunction is present, it adds more to the risk of diabetic retinopathy. So, any person who is after 45 years of age should get at least an annual checkup done for screening of the blood sugar levels, the HbA1c, and if a person is diabetic, he should also keep on visiting an eye doctor to rule out whether he has retinopathy or not. So, talking to a person, suppose he is having diabetic retinopathy, what sort of symptoms does a person have? Usually, in the early stages of diabetic retinopathy, there may be no symptoms at all. The disease may be there, but it exists as a silent disease without any symptoms. Or early symptoms may arise, like there may be a dimness of vision, or floaters may be seen, that is, small specks floating here and there in front of your eyes when you see ahead. So, these are some very basic of early symptoms. As I told you, there may be people who may be totally asymptomatic, that is, without any symptoms. As the disease progresses, it may cause marked dimness of vision, or it may be a cause of irreversible loss of vision, that means blindness. To prevent such complications, to prevent from reaching to such an advanced stage, it is necessary that one gets his diabetic profile checked at least once in a year, and time to time he should visit an eye doctor and get his retina checked, whether he is not having retinopathy or even if he is having retinopathy. Now, talking to the treatment modalities that are available for a person having diabetic retinopathy. Various treatment options are there, and they are very effective if a person reaches the eye doctor in time and without waiting for a major complication to arise. The treatment number one option is laser treatment, which helps to prevent or to stop the bleeding of fine capillaries, the fine blood vessels in the retina, that is in the back part of your eye, and helps to stabilize the vision. The second treatment option is that the doctor may give you some intravitreal injections, that is, injections in the back part of the eye, and these may help stabilize the vision and absorption of small bleeding spots here and there in the back part of your eye. If there is advanced condition of diabetic retinopathy, if there is a massive bleeding in the back part of your eye, then a third treatment option is surgical treatment, that is vitrectomy. Although a person after vitrectomy may not get possibly perfect vision, but to a much extent, he may get uh, improvement, a perfect, considerable improvement in vision. These treatments are very much effective if the person reaches well in time. And as I already told you, a person should meet an eye doctor time to time. So I suppose these informations which I have given you must be helpful to you, and many of those who are having diabetes or still they are having a complication that is diabetic retinopathy, they should consider these advice very seriously. If they are not yet considering their disease very seriously, but they should consider it that yes, they should not neglect it. A negligence may cause irreversible damage to your retina and may cause irreversible blindness. So, better prevention. I hope this information must be helpful to most of you, and you can share this information to many of your friends and your groups so that all those who can be uh,